Welcome to the Care for Kūpuna podcast, where we dive into health, wellness, and vibrant living of our cherished Kūpunas. We are thrilled to take you on a journey exploring everything from health and wellness tips, deeply rooted in the spirit of Hawaii, to navigating the intricacies of retirement, preserving our rich culture heritage, and fostering vibrant communities for our elders.
Whether you're a Kūpuna yourself, a family member, a dedicated caregiver, or simply someone passionate about supporting and uplifting our elders, this podcast is for you. Each episode is crafted with love and the intention to inspire, inform, and celebrate the golden years. So sit back, relax, and join us on this meaningful journey as we care for Kūpuna. Welcome to this week's episode of Care for Kūpuna, where we care for Kūpuna. I'm Trina.
I'm Lani.
And we are your Kūpuna Care Girls. This week's episode, we are talking about Part D, or prescription drug changes. You're also going to hear this phrase called IRA. It is not what you're thinking. It's actually referencing to Inflation Reduction Act, is a term you will be hearing a lot. It affects many areas, but today we're going to focus on prescription drug changes. So what does that mean? So it really is going to be affecting those that have Medicare and their prescription drugs. So what are the changes for 2025 is elimination of the coverage gap with the new $2,000 maximum out of pocket across all prescription drug plans. Extra help programs will now help more people, which is great. And Medicare prescription payment plan can even out high copays in the beginning of the year. It will not change the cost of the prescription, but Medicare prescription drug payment plan can start anytime throughout the year. And mid-year letters of unused OTC benefits will also be implemented this year.
Yeah, and you'll be hearing a lot, especially during this annual enrollment season. And the Inflation Reduction Act drug provisions implementation timeline didn't start in 2020, or it's not going to start in 2025. It actually started back in 22. That's when it was signed into law by President Biden on August 16, 2022. And it includes several provisions to lower prescription drug costs for people with Medicare and reduce their drug spending by the federal government. So, like, for example, in 2023, it required pharmaceutical companies to pay a fine if drug prices rise higher than the inflation rate. And some of you may have noticed that your insulin was capped at $35. So there are, all of these time milestones from 2023 to 2029, but we're going to focus on that 2025, especially this annual enrollment, how that's going to affect you and your plan for next year.
Right. And that's because it's going to be the most dramatic change that we've seen by far. So what does that mean? Lower prescription drug costs. Out-of-pocket costs for your prescription drugs will be capped at the $2,000. Some high-cost prescriptions will have negotiated prices, so which would be great.
And expanded coverage as well. So increased benefits for preventive services and vaccines. Possible additions of new treatments and therapies.
That's good. Improvement cost transparency. So enhance information on drug prices and treatment options, efforts to simplify billing and reduce unexpected medical costs.
Yes, we love to hear reduce unexpected medical costs. We also have increased support for low-income beneficiaries, so additional programs for those with limited incomes, and expanded eligibility for financial assistance.
And important note is potential confusions and impact on coverage. So while these changes are designed to improve affordability and access, they may also introduce complexities or affect your current coverage in ways that could be confusing.
Yes. And, the need to help and understand the changes while you have Trina and I, navigating these updates can be challenging. Our insurance agency, Premier Benefit Consultants, is here to provide you with clear guidance and support to ensure you understand how these changes will impact your Medicare coverage. So make sure you get in touch with us. Go to our website, careforkūpuna.com, and that's care with a K. And you can click on the link for Lani or Trina, and as we are the trusted partners for Care for Kūpuna, and we'll be more than happy to help you navigate through this confusion. Okay, so please don't hesitate to reach out. Before we end this episode, we usually have a joke, a quote, or a pun, and today our joke is a knock-knock joke. And I like to actually refer to it as a dad joke. Knock, knock.
Who's there?
Pippa.
Pippa who?
I can't tell you. So silly. Thank you to our listeners for joining us on another episode of Care for Kūpuna, where aloha meets wisdom, one podcast at a time. Until next time, ahui ho.
Ahui ho.
Mahalo for joining us on this episode of Care for Kūpuna, where we explore health, wellness, and vibrant living for our cherished kupunas. We hope you found inspiration and valuable insights.
Remember, your support can make a difference. 20% of all proceeds from our podcasts go to a nonprofit organization here in Hawaii dedicated to helping seniors in our community. If you'd like to contribute, visit our website at www.carewithak4kupuna.com and make a donation.
Are you a brand or business looking to align with our mission? Consider sponsoring our podcast. Visit our website for more information on sponsorship opportunities.
For those with stories to share, we invite you to be a guest speaker on our podcast. Head over to our website to express your interest and become part of the conversation.
Last but not least, stay connected with us by subscribing to our email list and following us on social media at Care for Kūpuna with a K. Join the Care for Kūpuna community to stay updated on all things related to health, culture, and creating vibrant communities for our elders.
We appreciate your time and look forward to welcoming you back on the next episode of Care for Kūpuna.